Customizing the plan, all of these different options are available, and I see I'm running out of.
Okay, so I have 10 o'clock. At this time, we're going to go ahead and call the meeting to order. And we'll begin by doing a roll call of members present. TAC members, if you would, when you hear your name.
In New York City, we have an adaptive services team for people like Maggie mentioned who are deafblind or may want to need a smaller class and client.
Okay. First off, I guess I should remind everyone, if you could keep your microphone on mute until you want to be contributing to the conversation. At any time, you're welcome to unmute, but during the course of the meeting, if you could keep it on mute to prevent that background noise from coming through, we'd appreciate it. At this time, though, we are going to ask you to unmute your microphone and enable your video so that we can ensure who is in the meeting today. So what we're going to do, TAC members, is go through an individual roll call. And so whenever I call your name, like I'll say Stephanie, if Stephanie could unmute and share video and just let us know that you're present and what school district and school you represent as a TAC member. So to begin, we have Stephanie.
Hi, I'm Stephanie Beeson. I am from Warren County Public Schools.
Thank you. Chandra.
Hi, I'm Chanda Britt. I'm from Kentucky School for the Deaf.
Thank you. Miles. Okay. All right, Bo.
I'm Bo Mullins. I'm from the Kentucky School for the Blind.
Thank you. Lainey.
I'm Lainey Neal. I'm from Montgomery County Schools.
Thank you. Nora. Okay.
I just admitted Nora.
Okay. Nora.
Yes. Can you see me and hear me now?
Yes, yes. Glad you're here.
Thank you. I don't know what happened first.
Yeah, we're doing introductions, so go ahead.
Okay. You want me to talk?
Yeah. School district and school. Yeah.
Okay. I am Nora Ramsey. I am going to be teaching first grade at North Kellaway Elementary this year. I'm excited to join you guys.
Awesome. Thank you. Jolena.
I'm Jolena Sizemore. I teach in Laurel County at Hazel Green Elementary.
Okay. Thank you. Garris.
Hey, this is Garrett Stroud, Hopkins County Schools. I teach 8th grade writing at Browning Springs Middle School.
All right. Thank you. Carrie. John.
I'm John Whipple. I teach 8th grade social studies at Breckenridge County Middle School.
Thank you. Quentin?
Hi, I'm Quentin Johnson. I teach English at Tates Creek High School in Fort Fayette County Public Schools.
Okay, thank you. Jennifer?
Hello, I'm Jennifer Howard, and I teach high school math in McGoffin County at the only high school.
Thank you. Taylor?
Hi, I'm Taylor Sullivan. I teach science at Larry A. Ryle High School in Boone County.
Thank you. Alan?
Hello, I'm Alan Hensley. I teach middle school science at Carter G. Woodson Academy in Fayette County.
Thank you. Beverly?
I'm Beverly Rutledge. I teach in Carter County.
Okay, thank you. Tiffany?
Tiffany Dunn, an ESL teacher at Lassiter Middle School in Jefferson County.
Okay, thank you. Kim? Okay. Brianna?
Stacy, Kim just admitted.
Okay. Let's see. Brianna, if she's, do you see her?
I do not.
Okay. Kim, we're doing a roll call. So if you're able to unmute and share your video, verify your attendance and your school district and school.
Can you see me? Or can you hear?
Yes, yes.
Okay.
Yeah. So just share your name and school district, please. All right, sounds like we got a little audio trouble there. So Kim, if you want to, you can just mute your microphone and then we'll verify the attendance later. But Kim represents Middlesboro Independent. So we'll go on to Angela.
Hey, I'm Angie Bevan. I teach at Peaksman Elementary in Franklin County.
Okay, thank you very much. All right, so on my end, I'm hearing a lot of background noise. Paul, do you hear that as well?
Yes, ma'am, I do. I'm trying to find out who it is. I was going to mute them. I'll keep searching.
Okay, well, thank you. All right, so now that we have done our roll call, we're calling the meeting to order. We're going to be welcomed by Commissioner Brown. So I'll turn it over to Commissioner Brown at this time.
Thank you, Stacy and Paul. I want to welcome everyone. As you can see, we have a large agenda today. We have a 2-hour meeting. I know that's quite a long time for an online meeting, but as you will see, topics obviously pertinent to what we're dealing with right now. I know there's a lot of anxiety out there, and that's to be expected. There's anxiety all over the country right now as we approach getting back to school. There are some things we will have answers for today. There are other things we don't have answers for. That's why we have advisory councils. Your feedback is important as our teaching force, most important folks in education other than the students. So we want to hear from you today. There is, just by the nature of it, there is a lot that you need to hear from us to go over guidance that has already been issued. But I want you to understand, because some of this guidance has already been issued, that doesn't necessarily mean that it's the final say on these topics, because we know we're in a global pandemic. The situation is changing, just as you've heard the governor say many times about how the Healthy at Work guidance has changed and evolved since it was issued, and employers are asked to continue to check up-to-date versions on that. We anticipate that some of our guidance will change. We will have, I think, up to 16 guidance documents total for school districts as we begin the beginning of the school year. We anticipate some of that to change just because we know the virus is changing. The situation could change in our state. I had a conversation with the governor yesterday, and he reiterated that the good news is that the mask, they're seeing more evidence that people in Kentucky are wearing masks. The bad news is we are also having an increase in the number of virus cases in Kentucky, not to the degree of other states, which I think is a testament to how Kentuckians by and large have handled this. So I think we're in a little bit better position to start school. However, we still have to be cautious. So we need to hear from you, your concerns about all of these documents and all these issues that we're going to go over with you today. And of course, the last agenda item, we have our friends from Public Health. They've been joining us for almost every webcast, every advisory, Dr. White, Dr. Meserly, and we've had a great working relationship with them, a daily relationship with them. As you all know, about 3 weeks ago, we issued what we call the flagship document, which is the document detailing healthy at school, the mask issue, the social distancing, and then all the other 15 guidance documents that we have are all go into much more detail than that flagship document on various issues that you'll hear about today. So I don't want to take up any more time. I will close out by saying, as you know, the State Board of Education has selected a new Commissioner of Education, Dr. Jason Glass. Very pleased with how that process turned out. The board should be commended for really, they did a national search that also included Kentucky candidates and those with connections to Kentucky, as Dr. Glass has. He is born in Kentucky, educated in Kentucky, taught in Kentucky, and then also had part of his professional career in Iowa and Colorado and some other places. So we're very excited. The downside for me, though, is Dr. Glass is not going to be able to start until mid-September because his school district there in Colorado obviously wants him to stay, as his contract allows for, to open school. So you all are stuck with me to open school. I was kind of hoping Dr. Glass would be here right now, but we're gonna, as the governor says, we're gonna get through it. We're gonna get through it together. We've got a great team, all on the ground in all of our districts, and team at KDE, and we'll have this ready to hand over to him in mid-September. So I'll turn it back over to you, Stacy, and I'll be on the entire call.
Okay, thank you very much. All right, so I wanted to go back to the opening slide and do just a few technical reminders. This meeting is being recorded, so I wanted to make sure that everyone was aware of that, and it will be posted for access to the public. Reminder to the TAC members to please make sure that you access the digital sign-in on our Google site, and you'll notice the links there to check in digitally. So we've got multiple ways to confirm attendance. And then we have our agenda for today, July 14th, 2020, and everyone has had access to this agenda. And at this time, we need a motion to approve the agenda. If I could get one of the TAC members to unmute and make a motion.
I'll make a motion to approve the agenda. This is Nora Ramsey with flexibility.
Thank you very much, Nora. And a second.
This is Stephanie Beeson from Warren County. I will second the motion to begin, or second the motion for approval of agenda.
All right, wonderful. Thank you, Stephanie. All right, and our last meeting was April the 21st, and those meeting summary notes were shared with the group. As well, we need to go through the process of approving the meeting summary notes from our April 21st, 2020 meeting. So if I could get a motion to approve.
This is Jolena Sizemore from Laurel County, and I will make a motion to approve those minutes, meeting notes.
Great. Thank you, Jolena. And a second?
I will second that, Nora Ramsey.
Thank you, Nora. All right. So with that, we're going to transition to item 2 on the agenda, facilities guidance, and we have Kay Kennedy with us to share information. Kay?
So Stacy, if you could share your screen with the slides, please.
Yes.
I'm not seeing that.
Okay. Is anyone else seeing it?
No, it's not showing
No.
up.
It's not showing up. Okay. All right, how about now? Do you see them now, Kay?
Yes.
They're up
Yes.
now.
All right, wonderful.
Okay, thank you. Hi, this is Kay Kennedy. I'm with the Office of Finance and Operations. And the guidance document that I am here today to share with you is considerations for reopening schools with facilities. And our guiding question is what needs to be done in school facilities to best prepare them for students in the fall. Okay, next slide, please. Our document is going to cover these topics: cleaning and sanitation, facility utilization, building systems, emergency drills, and operations. So I think at this time, Nora, I can share my screen.
Yes. Let's see. I'm going to stop sharing.
Okay. And can you see my screen now?
Yes, we can.
All right, great. In our guidance document for facilities and logistics, we do include a number of links, and those are always highlighted in blue, that actually connect directly to the CDC website, because they are our go-to resource for a number of topics in the area of reopening schools, whether it be, you know, for transportation or facilities, or just a number of things that we look to their guidance to help clarify for us. Don't know if you've had a chance to look at the guidance document yet. It is on the KDE website under reopening, a number of documents there, but please refer to that when you need further guidance. In general, cleaning and sanitation information may be found on the CDC website, and you can just click on the link and it takes you right to the pertinent information. Prior to opening the facility, the reopening committee in a district or even within a building should think about what will be the necessary cleaning and sanitation supplies, which does include personal protective equipment for custodial staff. It is very likely that the custodial staff will be using maybe some different products this year to maintain the highest level of sanitation and disinfection for the school. So we want to make sure that those folks are protected. And keep in mind that frequent cleaning throughout the day is going to be necessary for those high-use areas. There may be some portions of the facility which are not going to be utilized, and we want to make sure that we don't have folks wandering into places that are not supposed to be utilized and maybe consequently haven't been part of the custodial cleaning routine. So we want to make sure that if there is a confirmed case of COVID within a site, that the additional cleaning and disinfection occurs. That guidance is on the CDC website and may be accessed through this link. As schools and districts plan for reopening, we recommend that an inventory of spaces within a particular facility be done to determine the type of service that will be needed, the frequency of service, whether that's a high-use area or one that is only periodically or less frequently used, what product should be used to clean the area, and if there are other particular instructions that need to be followed in that particular area. And as part of our guidance document, we have included in Appendix A a model template for an assessment of each site so that you can track how you're going to provide that custodial service. Next, we have, in terms of facility utilization, one of the key mitigation strategies is to maintain the 6-foot social distancing between students. And how does that really affect what goes on in the classroom? So we have provided, and I'll show you here, a room capacity calculator, which does allow a district to put in the square footage of a particular space and how much of that space is actually usable, and then to calculate the occupancy. So for example, let's say you have a 900 square foot classroom, but you can only use 75% of that classroom for student spacing. And the calculator allows us then to see how many students could you put in that room if you were going to consider a 6-foot block for social distancing, a 6-foot circle, which does have a little bit less area, allows you to get more kids in there. Or if you wanted to increase social distancing, for example, in an 8-foot block or an 8-foot circle, how could you fit students in there? So we do have some commonly used classroom measurements that are already done for the district, but if there is a different size space, for example, let's say you have a 3,000 square foot cafeteria that you can use maybe 80% of that space, then according to this model, you could achieve 67 students in the cafeteria, or you might consider 86 students if you were using a 6-foot circle as your guidance for social distancing. So again, that's just a tool that we've provided to districts that hopefully they will find useful. Okay. Within the facility, the planning team should consider other enhancements that would improve mitigation strategies. Hopefully there will be multiple hand sanitizer stations. Hopefully someone is monitoring how hygiene products are replenished and changed according to their usage levels. There may be a need to install plexiglass shields in public areas such as your reception area or perhaps at the cafeteria cashier station. That would be helpful. Is there a capability to put no-touch trash cans? And then we wanted to make sure that districts and schools were aware that signage is available from the CDC, free signs that publicize these strategies for mitigating the virus, and those are free for download. And we would also like districts to consider their water fountain procedures. It is a recommendation of the CDC that you don't drink directly from the water fountain, but you use filling stations and allow students to have water bottles that they can then manage their own water throughout the day. Also in facilities, it's important to consider building systems and specifically the HVAC system. Air circulation is one of the recommendations from the CDC to improve the conditions in a facility, to allow that circulation. That guidance from the American Society of Heating, Refrigeration, and Air Conditioning Engineers, commonly referred to ASHRAE, has provided guidance that building plant operators can utilize to maximize circulation in their buildings to allow fresh air. There are 3 basic mitigation strategies that can be utilized with the building systems. Dilution, which is reducing the concentration of infectious agents. Filtration, where you actually trap bacteria and viruses by passing them through a filter. And districts may want to consider their change schedule on air filters in the HVAC system to make that a little more frequent. And then there is a purification step, which actually can destroy infectious agents. And that can be done through humidity control, through room humidifiers, and there's other techniques that do come with some cost, but may be available to your district. The next topic we cover in our guidance is the emergency response drills. This information has been provided to us from the Kentucky Center for School Safety. And, as you start the school year, these emergency response drills are very important, but KCSS has advised that they should be done with all precaution for safety in terms of the COVID virus. So you might want to consider doing your fire drills in a blocked format where you can do it by perhaps maybe by wing of the building or certain classrooms, so that you can maintain social distance and still impart the response information to your students. Fire drills, lockdown, severe weather, earthquake, all the normal drills you do. We are recommending that you still continue to work those in your opening schedule as you normally would. They just may take a little longer to accomplish as we maintain the mitigation practices. Another thing that will need to be considered this school year is traffic control. You may encounter more parents who actually want to drive their children to school as opposed to putting them on the bus. So the school district is advised to perhaps survey the parents and determine if there's going to be increased car ridership and if there will be any changes necessary to manage that flow of traffic. Especially as we consider how students will unload from the car and get into the school building with any necessary health assessments, such as temperature taking. For drop-off and dismissal, again, we're recommending that schools very clearly communicate to parents what the expectations are in terms of drop-off times and pickup times, so that we don't have congregations of students just standing around waiting, and that can be done in a manner that is socially distant and allows for the safety of all students. Students will have their temperatures screened upon entry to the facility, and this can be handled in a number of ways. There may be multiple entries set up. One for car riders, one for pupil transportation that's done through the bus. So again, it's a planning exercise for each facility to determine how they can best move that number of students into the building and onto the classrooms. We are encouraging that student dismissals be staggered to eliminate bottlenecks and the congregating of students. And also that older students be used to hold the doors to limit the touches and to allow students to exit maybe a little more rapidly. Building security, CDC recommends opening doors and windows when possible. And again, this might be in conflict with your safety and security policies. If you have any questions, we're recommending that you contact the Office of the State School Security Marshal with any concerns that you may have. As we finish up, here's an example of the site inventory worksheet and the type of service, frequency, products, and other instructions that may be necessary to share with custodial staff. Again, to reassure folks that that all spaces are being considered and are handled in an appropriate manner. And then finally, here's a sample custodial checklist to make sure that all of the spaces are being taken care of, and that within each of those spaces we do have all of the functions that are recognized and being handled on a regular basis. Okay, so with that being said, I can stop sharing my screen now. And so Stacey, I don't know if you're going to take questions now or at the end.
Well, you have a little time in your allocated time. So if we have questions from the group, I think it's okay. If you're okay with that.
Sure.
Okay. TAC members? Well, Kay is going to be on at the end of the agenda as well. So if you have questions related to facilities, just jot them down, and then we can circle back around, and I'm sure she'd be willing to address those. Sound okay, Kay?
Absolutely. And if you think of anything and you want to put it in the chat, we will also be monitoring the chat as well. And that function is on your toolbar. So if you need to add anything to the chat, that'd be great.
I do have one question. This is Angie Bevan from Franklin County. Can I go in and ask real quick?
Absolutely.
Okay. I teach 5th grade, and so I'm just kind of visualizing, because really the only time they'll be moving, I guess, outside of my classroom, I'm guessing, is like going to the bathroom or going to get their lunch. So what would going to the bathroom look like? Like only a certain amount of kids in there at a time? I know they would wear their mask, but I'm trying to like wrap my head around that.
So again, how you're going to manage that in terms of what would be the acceptable number of students to have in the restroom. And again, that depends upon the size of the restroom. So if there are, let's say, for example, maybe 6 stalls in the restroom, and really to achieve social distancing, you might be able to only use every other one. So that, you may be able to have maybe 3 kids in the restroom at a time. And again, it's not a place to hang out. So, as you're able to monitor, that movement and that kids are not congregating in there, I think I would allow for a little bit longer time than you normally would have for bathroom break. And you might incorporate that into some silent reading time, that part of the students are sitting quietly at their desks, and you allow the others to go. I mean, it just depends on, how things are located in your building and how you're coordinating with the other teachers in terms of the number of restroom facilities that are available. It's a complicated picture until you throw a schedule on it, and then everybody knows when they're supposed to do, what particular activity that may be helpful. So again, careful planning, I think, will help you get started. And then, as always, a good plan should have the ability to be adjusted as you see how things really work.
Yeah. Okay. All right. Thanks.
I've got a question.
Sure.
I'm Miles from Jessamine County. So the minute you get everybody in the room, whether it's 2 kids or 10 kids or 20, the air is just basically sealed off. I mean, a lot of what we've had to do over the years is with the lockdowns, we're required to have our doors closed, and in probably a lot of cases, you're supposed to have your windows closed. The air in there is stale. It's not going anywhere. That air in there is sealed in there for at least an hour. I mean, has anybody done any study? I know this has all come up quickly, but any studies about the air quality in a lot of the classrooms? I mean, you have a variable of old buildings and new buildings.
Right.
And the lockdown situation, which obviously is very necessary, has also created the issue of, I mean, that air is pretty much just sealed up in that room.
Right. So, again, it depends upon the age of the building and how recently the HVAC system has been upgraded. In the current environment, there are air exchangers which theoretically turn over the air so many times an hour. So, you're lucky if you're in a situation where you've got that type of equipment that's running your HVAC. And again, I think the recommendation is if you have the ability to increase ventilation, at least for a period of the time that you have the students in class, maybe you can't do a complete what's the opposite of lockdown? Unlockdown. Maybe you can't open everything up for the entire hour, but maybe, some portion of that time. So again, the state's school security marshal definitely is wants to be part of the consideration as we try to, be flexible and adapt to this temporary pandemic. And I'm sure that they would be willing to have their regional evaluators come into any district and help evaluate if there are potential ways that you can improve the circulation and ventilation without posing any more of a security risk than you have to.
Kay, this is Connie White. Can I butt in?
Absolutely.
Hi. Hi, everyone. I'm Connie White. I'm the Deputy Commissioner for Clinical Affairs at the Department for Public Health, and I've been emailing with John Akers and Mr. Wilcox over the weekend. The Department for Public Health has used some grant money to get Eastern Kentucky University to develop a ventilation training program. One phase of it is for public health environmentalists in your local health departments to get a little bit better up to snuff on ventilation. And also they have developed a training for Department of Education staff members. So that training is getting ready to happen, and I believe Mr. Wilcoxon is going to, I saw an email this morning, we're going to try to get his 17 compliance officers trained on this and see how much our grant money will allow us to spread this to as many people that are interested, because all of your concerns are very, very well taken. How do you balance security of the air for your students and staff and faculty versus security of making sure the doors are secured and there's no safety issues? So this is a balance, and we're hoping that this training session will address that and will expand it if it appears to do such. So I hope that helps.
Yeah, thank you, Dr. White. I do know that KDE facility staff will be participating in the training that Dr. White mentioned. And again, as she said, if information becomes available, we will funnel that down to school districts and plant operators within the building.
Okay. All right. Well, thank you, Kay, for that very valuable information. And like I said, she'll be around throughout the course of the meeting. So if you have other questions that you'd like to ask, we'll hold on to those until the end. At this time, let's transition to item 3. This is food service guidance, and we have Lauren Moore with us, who's going to share some information about that. And Lauren, I'm going to share your slides, correct?
Yes, thank you.
All right, can you see them?
I can. Thank you. Good morning, everyone. I'm glad to be here today to talk to you about food service guidance. I do want to mention, as Kay said about the facilities guidance, the full guidance document is on the COVID area of the KDE website under the reopening section. So we're going to just hit the high points here, but if you're interested in seeing that full document, you can certainly find that on the KDE website. Next slide, please. So just to give some background about what child nutrition program initiatives have been taking place since schools closed in March, or of course went to virtual instruction, not closure, but there have been multiple different areas, different ways that child nutrition programs have been serving your students. One way that they have been, one support that has been offered has been the Pandemic Electronic Benefits Program, or PEBT. This is a SNAP type program benefit that's offered to households. And at this point, over 525,000 students have received over $160 million in our state through this program. We also have 20 districts who've participated in a Baylor University Emergency Meals to You program, which is where families receive 10 days worth of meals every 2 weeks. This is through mail order through Baylor University, and that program continues until August 15th. We also have had districts and other child nutrition program sponsors providing meals since mid-March through our summer food service program and seamless summer option. And then a final point is 88% of our National School Lunch Program sponsors have at least some level of participation in the Community Eligibility Program. And we have 76 of those sponsors have full participation, which means that all students in the school districts receive meals at no cost. And then the deadline for those districts that have schools who are eligible to participate but are not currently participating is August 31st. Next slide, please, Stacy. So just to let you know, we have the guidance document that's on our KDE website right now is for in-person meal service. So our initial document that was released is discusses food service operations that are actually going to take place in the school building. But recently, at the end of June, the USDA did release or extend meal service program waivers, nationwide waivers that will allow students who are going to participate in virtual instruction to receive meals. These waivers are for the entire school year. As you see here, those waivers expire June 30th, 2021. It will look a little different than what it looked like when the transition happened in March. We were feeding through the summer food service program and seamless summer option, which is available for all students 18 and younger. The programs that will be in place for this upcoming school year will be for food service operations for enrolled students. Next slide, please. So as I said, the guiding document that we have released initially, and there will be a second document that addresses virtual instruction, but today's discussion will be about the initial document for in-person, and our guiding question for that is what factors should KDE consider when assisting districts with preparation for food service? The initial food service document focuses on 4 areas of consideration, which are listed here: meal service environment, the meal pattern, food safety planning, and operational support. And I'm going to turn the presentation over to Katie Embry. Katie is our school meals program manager, and she's going to go into a little bit more depth in each of these areas.
Thank you so much, Lauren. Next slide, please. Again, thank you all so much for joining us today, and we will be talking about what meal service will look like in the building. So first, we're going to start with meal service environment considerations. When planning and when starting your plan, it's important to identify meal service locations that are in the building and what service methods will be utilized with your location. Can you serve meals in the classroom or other large open areas? Would it be possible for students to pick up grab-and-go type meals that will help with meal delivery? Can meal schedule times be adjusted to allow for cafeteria use with reduced capacity? It's very possible that during a single meal service period, multiple meal service methods may be utilized with different groups of children in the same school building. Next slide. Also, with meal service environment considerations, after the locations and food delivery methods are identified, consideration should be made for the logistics of the meal service. What equipment's necessary, supplies, or resources are needed for meal service methods? Can meal service periods be staggered so that arrival and dismissal times limit the amount of contact between students in high traffic areas? We need to make sure that there's adequate time to allow for proper sanitation between the use of tables or other services where multiple groups of students might consume the meals, that food service staff have time to clean and sanitize those areas when necessary. And also, it's going to be important to eliminate self-service stations and the sharing of any food items. Food service staff must also be mindful of following proper procedures to ensure student safety and, most importantly, their own safety as well. Staff will need to check their temperatures and complete any employee health screening according to district protocol when they arrive at work. Food service staff who develop symptoms during the workday, or any staff members who develop symptoms during the workday shall follow the district's policy for illness, and staff will wear a mask unless there's a medical exemption that has been granted. Food service staff, as well as any staff member in the building, may be highly susceptible to the illness, so it's important to create a culture of safety and teamwork to keep everyone safe. Next slide, please. Thank you. Also, with the National School Lunch Program, as Lauren stated, this is the National School Lunch Program that will be utilized when school's in session. And we have meal pattern considerations. So all meals that are served to students must meet the meal pattern to receive reimbursement. Consideration should be given to the meal service methods selected and the equipment that's available when making the menus. Is there enough hot, cold holding equipment for transporting and serving meals in alternate locations? And if not, how can the cafeteria best be utilized to deliver meals? Do food service staff have enough time for prep work, or is there a need to purchase food items that are less labor intensive? Also with accommodations. Accommodations for disabilities, when supported by the proper documentation, must be provided to ensure equal access to the program. Meals must be served in a manner that offers a safe environment for children with food allergies. And it's so important to work closely with all school staff who may be involved in the service of meals to students with allergies to ensure that the students receive safe meals. Communication in this area is key to keep everyone on the same page. We also have food safety considerations. Every school is required to have an individualized written food safety plan. And with the food safety plans, it's important that any new meal service methods that are being utilized or newly added procedures that are in place due to COVID are included, updated, and trained upon. All food service staff, as well as anyone else who might be potentially involved in meal service, should be aware of and should receive training on the standard operating procedures. All staff must have knowledge of and training on relevant SOPs for their job, but with an extra emphasis on standard operating procedures for hand washing, proper glove use, personal hygiene, serving safe food to students with allergies, cleaning, sanitizing high contact surfaces and food contact surfaces, and also on the district's food service health policy. Lastly, we have operational support considerations. It's important to have a clearly written operational policies and procedures be developed and implemented for food service. Food service staff must be knowledgeable about the procedures, and coordination and communication must occur between food service staff, building administration, and all other building staff. Also, it's important to have communication with households. It's imperative that student households know and understand how to communicate and interact with the child nutrition program. Some ideas on how communication could be utilized is the one-call service, email, district website, social media. Parents need to know if it's a non-CEP school, how can they submit an application for free or reduced price meals? How will they be collected? How will they be processed? Other information such as, will vending machines be available, a la cartes, or can you have visitors in the building? All of those sorts of decisions need to be communicated to households. And finally, we have resources available for everyone. We are conducting webinars. We held a webinar on June 25th for food service directors, and we will also have one on July 23rd. We also have dedicated staff members at SCN right now who are trained and ready to assist when you have specific questions. So feel free to email us at any time and we'll be happy to provide you with anything you need. Thank you so much. Any questions?
Okay, any questions or comments from our TAC members regarding food service guidance? Okay. All right. Well, thank you, Lauren and Katie. We appreciate you taking time to share that important information. We will transition to the next item on the agenda, item 4, plan for reopening secondary CTE labs during the summer of 2020. And Tom Thompson should be available. Is he on the call?
Yes, I'm available. Thank you.
Okay, great. I can't see who's in the room, so glad you're here, Tom.
Thank you. Good morning, everyone.
Before you begin, let's not forget we've got guiding questions there in our agenda. So for all these issues, and as Stacy said earlier, if you don't have a question now, please post it in the chat and issue. Just because this guidance has been issued, that does not mean there are not issues that we still need to address. or that you see maybe some flaws or some operational issues. So please reflect on those guiding questions, and maybe we can put the guiding question in the chat as well. If Stacy or Paul could do that as we're progressing along.
Absolutely.
Sorry, Tom, didn't mean to interrupt you.
Oh, that's all right. Thank you, Commissioner Brown. I'll go ahead, since you mentioned that, I'll read off this particular question for this session. What do you feel are the biggest barriers to reopening secondary CTE spaces for the completion of industry certifications and lab-based dual credit coursework? So if you see, whenever I'm reading through some of the guidance, and this is a planning document, so as I'm reading, if you think about some of those things and how it relates, you know, what barriers you can see, then we'll make note of that. And like Commissioner Brown said, we can make adjustments. So without further ado, I'll get started on it. Could you change the slide, please? Thank you. So this document was originally released on June 29th, and it is meant to be a companion document to a previous guidance that was released for students to participate in dual credit opportunities, to complete dual credit opportunities through KCTCS on their campuses. And we really appreciate the partnership that we've had with them. And their guidance was meant to get us started up to June 30th. And then this guidance took over where that one left off for CTE centers. Next slide, please. Thank you. So this was shared with the superintendents on during their webcast on May 19th that outlined the governor's approved plan for the KCTCS document was shared on the 19th. This one was shared on the 29th and the 30th with the superintendents, and it is really focused on those students that are graduating or graduated this spring for opportunities to earn an industry certification or finish up that dual credit. And when we're looking at those students, we want to make sure that we're providing that opportunity because since it's not really for accountability purposes, when you're looking at industry certs, we want to give that opportunity to help students in their current careers, or if that industry certification would lead to a career option for them. Next slide, please. So then the document is broken down into 4 main areas: general requirements, arrival and dismissal, transition between classrooms and labs, and then area-specific guidance in 3 areas of classrooms, computer labs, and CTE lab areas. Next slide, please. Thank you. So whenever we're looking at our CTE programs and we're thinking about creating that opening plan, if we've not already done it, or if we have already done it, we want to reach out to the health departments to make sure that our current plan meets the Healthy at Work guidelines or Healthy at School guidelines, and some of the documents that have been shared previously on the KDE's COVID-19 page. We want to work closely with that Healthy at Work or Healthy at School officer to ensure the development of the plan addresses students who test positive for COVID-19. And the plan should be established prior to reopening with input from the local health department, like we said. Next slide, please. So we want to prepare the plan to determine which students will have the opportunity to test or complete dual credit. And again, we want to prioritize the students that are going to have the most benefit to start with, the ones that we want to look at those ones where that industry cert is going to give them a job or get them out into their career or help them in their current career. And when we were preparing that communication plan, we want to make sure that we have some way to reach out to those students to see if they're interested in completing that. And then we want to make sure that we confirm through some type of permission the willingness of the student and parent to participate in the in-person completion of those activities. And if the student's 18, we ask that they at least give notice to their parents, just to make sure that they know they're putting themselves in that in-person environment. Next slide, please. So we want to require that scheduling of students be conducted in compliance with the Healthy at Work minimum requirements. Anyone entering the school needs to complete a health check, temperature. And I think in previous guidance, there was a sample form that was given out that Kentucky Department of Education uses with their staff. And so that's a good document that you could use for a sample. We want to maintain records of all students and staff in the building to help with contact tracing in the event there is a positive case of COVID-19. Prohibit access to water fountains. And the reason we put this one on there just to make sure that folks are aware of that before they get there. If there's any modifications to bathrooms or access to water fountains or anything, that they need to know that up front so they're prepared for it when they get there. And then, like I said, bathrooms must be limited to the number of folks that would limit proper social distancing, so that's 6 feet that we're constantly talking about. Next slide, please. Require proper hand washing and hygiene. Hand sanitizing must be required of students prior to starting any work within the facility. High-touch surfaces must be cleaned on a recurring basis. All staff must wear cloth mask or face covering in accordance to CTE program safety guidelines. And then whenever, when we're moving within the building, we want to make sure there's a mask on. The only time that there wouldn't be a mask is if you're in complete isolation, or if you can distance yourself enough to where that wouldn't be an issue. And when I say complete isolation, if a student is in a welding booth participating in an industry certification, they're going to be in there by themselves in that area. So a face mask might not necessarily be required at that point. Plus, they have program area specific professional or personal protective equipment on at that time too. Next slide, please. So adherence to additional requirements of the assessment vendor. So some of the industry certification testing may require additional requirements that they would need to adhere to. To the greatest extent possible, we want to keep the same group of students together as much as feasible, and that shouldn't be too much of an issue because the type of class, I mean, if you're doing an industry certification, most of them are taking that same industry cert on that roster. So in the summer months, it's probably not going to be that big of a deal, but we want to keep them together. So if there's a positive case of COVID-19, that helps those contract tracing efforts. Next slide, please. So another section of the guidance is arrival and dismissal. And so we ask that staff and students shall remain in their vehicles away from the entrance of the school until their designated arrival time. Queuing, waiting areas, waiting lines should be avoided. And we need to make sure that we make arrangements early enough for the students to arrive and get through those health checks and temperatures readings before we actually get to the testing area. So no more than the maximum number of people in per healthy at work guidelines. So again, we're looking at that 6 feet of separation in the computer labs, classrooms, and the shop spaces. If there are small areas that you can't distance yourselves in that amount, or you can't distance the students at 6 feet, then we need to make sure that we avoid those areas if we can. If not, then masks need to be on. And I'm looking at areas like tool rooms, small storage areas, locker room areas. Next slide, please. So transition between classroom and labs. Students will be released in small groups with instructions to maintain social distancing. Preparation will be required to ensure orderly transition. Teachers will set out materials, tools, prints, anything that's required of industry certification or the lab work they're doing. Students moving between labs will make every effort to maintain reasonable distance away from each other and the instructor. And then students will be asked to inform teacher assistants should they need to move between labs or be excused for any reason. Next slide, please. So like we said, this is the area specific guidance is broken down in 3 areas, and you can get to the full document on the KDE COVID-19 reopening page. But in general, for those those areas, seating should be separated 6 feet with designated seating labeled. For sanitation purposes, students may be asked to provide their own materials needed for industry certifications, and we're looking at the testing materials we'll provide, or the vendor or the school would provide, but pencils, notebooks, calculators, anything like that, we ask that they do, but schools should still be prepared to provide that in the event a student can't. Of course, it needs to be properly sanitized. computer workstations, desk material, equipment, tools, seating, any of that needs to be disinfected after each use. And then instruction must be given regarding the use of healthcare protective PPE in conjunction with the program-specific PPE. And again, when I say program-specific PPE for CTE, that means safety glasses, welding hoods, work gloves, that kind of stuff, in conjunction with the PPE that we're requesting them that they wear for COVID-19. Next slide, please. So that is the end of the guidance for the document. Again, like I said, the full document is on KDE website under the COVID-19 reopening. If you've got questions, you can reach out to me. My information is here. And then Leslie Slaughter is our executive advisor. She helped in the creation of this and communication of it. So if you've got questions on either of those, you can reach out to us, or if you've got questions now. And again, I'd like to reiterate that I'm looking for the biggest barriers, and for my guiding question, I'm looking for the biggest barriers you can see to reopening secondary CTE spaces for industry certifications and dual credit. But that also goes into, in the fall, you know, what are those barriers we're going to see in the fall when we start opening?
So TAC members would like to open up the floor and allow you to share some insight about barriers. What do you feel might be some barriers that we need to be aware of?
I'll speak. This is Nora Rainsy, and I will preface it with I am a first grade teacher, and I also am a mama with a 5-year-old that's supposed to be coming to kindergarten. And I sat and listened to some of the expectations for kindergarten and first grade at my district, which I know is going to look very differently across the state, because just listening to how it was presented today was a little more positive than how it was presented to my staff. But I am concerned about the social emotional needs of our students. I have a 5-year-old that siblings are all teenagers and hasn't had many opportunities to be around other 5-year-olds. And one of the main reasons I know he needs to go to kindergarten is because he needs to build those skills, sharing and how to play with other kids his own age. But with all of the, in our district, kindergartners in desks, not tables, facing the teacher, outside at recess. If they're going to touch any equipment, they have to be wearing their masks, but kindergartners aren't wearing masks, so they can't play on any equipment. They have to play 6 feet apart. Everything all day is 6 feet apart. Right now, they're trying to figure out how they can eat in the room 6 feet apart. I mean, how do they build? And as a first grade teacher, I'm wondering the same thing as a teacher as I am as a mama. The only thing I'm really worried about going back is the social emotional needs, because they've been out of school for 6 months. We are living through trauma. Pandemic is traumatic for teachers and students. There's research behind that. And before they're ready to learn, we have to address the needs that living through a trauma puts on an adult and a child. And I'm afraid that we're missing that part. How do we make sure that we are addressing those social emotional needs so they are ready to learn? And so mamas who are dropping their babies off in kindergarten and first and second grade know that they're doing the right thing, because right now I'm considering paying for daycare that I can't afford for another year, because I'm not sure that holding them out another year till it's more normal might be better.
I think you just summed up I think you summed up the anxiety that's going on around the state, not only for parents, as you are a parent, but also for teachers. We have issued guidance on social emotional impact, and it's easy for us in Frankfurt to say, well, we have a guidance document for that, and we pretty much have a guidance document for every issue we can think of. But it's a lot harder when you're on the ground trying to deal with these situations, and there will always be circumstances that there's no guidance for, that and no way we could have envisioned things that you all will encounter. So that's not an answer to your question, other than that we are aware of what you identified, that social emotional health is a concern in a normal year. Coming back from a normal summer, we have students with trauma because of things that go on in their communities and families and in their lives. And we know that that's going to be double or tripled this year because of the aftermath of not having in-person classes, et cetera, not having those life experiences and field days and all those things that students looked forward to they didn't have last year. And we know that has an impact on their emotional health. So any other KDE staff want to comment on that guidance document or any other of these issues? It sounds like we may want to, the fact that we've already issued the social emotional guidance, that was, I believe that was earlier on in the summer. It's this probably is a good reminder, KDE staff, if you all can take note that we may want to bring that back up again for a superintendent webcast on our others as well. It's one thing to issue it and say that it's out there, but we need to keep it. We need to keep talking about it and working through those issues and how we can provide expertise and resources to districts as they engage in this and encounter this.
I do have a quick question. It's Angie Bevan from Franklin County again, and I'm sorry, I can't remember who just spoke, but I completely agree with you. I kind of had a meltdown the other day because I was just thinking about kids eating lunch 6 feet apart. It's like I feel like they're gonna, it just almost like I'm worried about the kids too, and really about the teachers on an emotional aspect, because looking at them, it just makes me sad even talking about it, because I feel like they're in prison. They're just like eating alone. So then I was thinking, like, would we be able to eat outside if it weren't like scorching hot? Would that be an option?
I think it's my general understanding. I think we already have our public health folks and Kay and others, Lauren, on here. Generally speaking, outside is better.
Okay.
For almost all activities, just because of that fresh air component. Of course, there are other safety considerations and weather, et cetera, that you got to be aware of, and then heat if it's excessively hot.
Right.
Kay, Dr. White, others, is that correct? Am I correct in that if they can facilitate being outside, that is better? That doesn't erase the social distancing need.
Right.
Yes, Kevin, this is Kay. That's correct. Based on guidance from the CDC, and Dr. White can certainly weigh in. But again, the logistics and scheduling of allowing this classroom to go over by the maple tree, and this classroom can go over by the fence or whatever. Just working through that kind of logistic, I think would help reassure folks that there are options. Teaching is going to be and feel and look very different this year. And the more you can think out of the box and share with each other, and I see the teacher groups on social media, there's so many creative things going on. But just coordinating that within a building, to make sure that we're not, all trying to do the same thing at the same time, and that you can share resources. I think that will be critical.
And this is Dr. White. Yeah, I agree with what everyone has said. Everything's going to look different, and the flip side of not doing the social distancing, the wearing the mask, is having more illness at home, because some of these kids will be traumatized because grandma died over the summer, or daddy was sick for 3 weeks, so there are other traumas that these children can suffer if we're not careful mitigating as much of this disease as possible.
I have a suggestion here. when we go back to school, every time we do a new school year, really doesn't, I mean, whether it's with, K through 12 or even the adults, you're always orienting people to do this and go there and here are the bathrooms and all that. And I really feel that your spread or your prevention that starts on the first day of everybody coming in the building. And I think one thing that would help is to recommend to the districts to make sure they do just a short, teeny tiny, even online safety orientation, instead of having to worry about, gee, is everybody going to listen on this first day? Is somebody going to pull their mask off while I'm talking to them? I think the districts and Kentucky would be way ahead if before they start up school is if they have a short online orientation saying, school is going to be different, like a little tiny video, and then they do something that they make sure that we reach our special needs and our ESL students. That way it's, the first day of school is what you're reinforcing what they already know, and that there are changes at school. And no matter what, even with, younger kids staying at home all this time, I mean, if I was 6 years old, I would certainly be hopeful that the whole mask thing, everything was done when I got back in the fall, and that it may not, people may not quite realize that, some of our younger friends. And but I think just a short video that's kid and family friendly, and I think that would really reach home, and I think that would help before that first day starts to do that orientation before they get there.
Commissioner Brown, isn't KEDC doing some communications work? And I'm not sure exactly what the format is for them to share that, but do you know some more about that?
Yeah, the Kentucky Educational Development Corporation, one of our co-ops, they are doing some video work. I'm not sure if it's designed as you describe it, Miles. I think that's a great idea. And we've also been talking with some other partners about some public service type announcements, but I think this goes beyond that. I kind of envision it as it's almost like the video you watch when you get on an airplane. However, hopefully it won't be ignored like that video is ignored, but some type of an introduction about what's expected. And we will reach out to KEDC to see if that is something that they can expand if they're not already working on that. Kay, if you will follow up with Tony about that as well.
Will do.
And this Dr. White, I just got off the phone earlier this morning with someone else in state government, and we were talking about masks, and she said, my 6-year-old doesn't understand why people aren't wearing masks, because we've been wearing one all summer in the house for her to practice. It's an expectation. So I think this video to set the expectations so people aren't, gobsmacked with this when they show up at the first day of school, that it's very clear what's expected. I think that's brilliant.
I think it's going to be a lot of little things adding up to getting there. Just anecdotally, I'm noticing, as I'm driving around, more people, and I'm sometimes in Louisville, sometimes in Lexington, and then I'm sometimes in a rural Garrett County, and so I kind of get a mix of it. And I'm seeing the mask usage increase a little bit. I think the fact that you had Coach Calipari, get on and he's showing a mask, you're going to be seeing UK and U of L athletes that are well known walking across campus and or in some type of class environment with masks on soon, as well as other role models. So I think all of those little things will help. Great idea. Thank you.
Yeah. Thank you for sharing. Okay, well, if we have no further comments, questions regarding item 4, we will go ahead and transition to transportation guidance. And you'll note on the screen there that we have the guiding question. You can see what the facilitators are hoping to get input around. What concerns do you have relative to the transportation of students?
Thank you. This is Kay Kennedy again, and Elisa Hanley and I will be talking to you today about pupil transportation. It's all well and good to talk about, how we're going to social distance in the classroom and feed and all that stuff. But if kids can't get to school, that will be a problem. So we'll talk about that. And you see the guiding question there. What concerns do you have relative to the transportation of students? Next slide, please. Our guidance is going to talk about a number of things. We're going to talk about pupil transportation options and how you can best serve the families in the district. Next slide, please. The mitigation strategies that are going to be necessary to ride the bus. Next slide. The number of students that will be on the bus and how we can facilitate that discussion in your district. And next slide, please. And then talk about employee health and safety. Often, you know, the bus driver, the bus monitor, these are the first folks that students see every morning. And we need to keep these folks safe, need to keep them presenting that positive face and that positive front to students as we move throughout the year. We'll talk about how to keep those folks healthy and safe. I think that's the last slide there. I'm going to move to share my screen now. And hopefully you can see our documentation considerations for reopening schools for pupil transportation. Our conversation will start with how to optimize the number of students on the bus, and I'd like to turn over the presentation at this time to Elisa Hanley.
Thank you, Kay. So there's several things that we're asking districts to look at when we're trying to optimize the number of students on the bus. And the first thing, which many of your school districts have already done or are in the process of doing, is to poll the parents. We need to see if they're going to send their students on the bus, if they're going to drive them, or if they're going to have them walk to school. If more parents are going to drive the students, then the districts will need to look at the staffing that they have and ensure they have a way to control the traffic flow. Districts will need to be prepared for increased number of riders, especially, and then after the first couple of weeks, as the parents become comfortable with the busing system, they may decide to no longer drive them, but to put them on the buses. And this may increase their need for drivers and rerouting. And this is also going to increase the need for, both of these items are going to need to increase the need for staffing out and about around the school. Another option for districts to look at is their bell times. To not have mixed loads of elementary, middle, and high school students on the same bus. This will help with loading from the back to the front and worries of where students will be sitting and with whom. Kindergartners may need to be closer to the front to better see them. And if you have mixed loads, it makes it difficult. And keep in mind that the kindergartners and preschoolers will not have masks. So by looking at the bell times, it will help with the need of transfer points where students are getting off one bus and going on to another, and just leaving those students on the bus that they started with. The next item is the walking distance. For older students, walking distances can actually be increased. And for districts that pick up within a mile of the school, there are programs available for safe routes to school, which provides guidance on maintaining safe walking programs, which will allow younger students to walk versus being picked up. And students can also set up walking school buses where students are picked up along their mile route and walk to school by a vetted adult. Now, what we don't want is our students crowded around waiting to get into the school, whether it's from cars, walking, or from the buses. Districts need to think about the processes and implement procedures that will help them facilitate social distancing. This may mean having only 3 buses at a time unloading and taking temperatures of those students while they get off the bus and enter through one door, as car riders are getting temperatures taken at another door. Or maybe buses are offloaded first and then car riders can enter while walkers are taken through another door. There may be several doors where staff is needed to take temperatures. So using different strategies available in this document may also limit the number of students in one area that need to be checked before going into the school. So once these things are considered, there's required mitigation strategies that will need to be implemented for those riding the bus. And the first here is wearing a mask. All students in first grade and above will need to wear a mask. Unless there's a medical waiver for those students, such as the IEP, students will become used to wearing them as time goes on. We have asked districts to work with the parents and the students through the summer to acclimate them to wearing the mask for the time that they're expected to be at the bus stop and on the bus. And for some students, this may be an hour, and for other students, it may be 20 minutes or less. It's really going to be dependent on their bus route. Seating thank you. Districts will need to load back to front. Now, which is why looking at bell times is so important. Younger students may end up sitting with older students with the back to front loading. We've recommended putting maybe the younger students midway and going to the front, but that is that is going outside of what we're trying to do with the back to front loading. Changing bell times will help with these mixed loads, and students will need to have assigned seats, and attendance will need to be taken before everyone leaves the bus in the morning and before leaving the school in the afternoon. So extra time is needed before these buses leave. And this is for contact tracing purposes. They need to know who sat where and when and what day. So it's very important that students are sitting where they're supposed to. The next area is temperatures of the students. Now, temperatures will need to be taken before the student goes into the school. And there's several choices to include taking the temperature as they enter the bus. If this is done, a monitor will be required so that the driver can continue to watch the road and other students. And the last area is hand sanitizer. Hand sanitizer will need to be given to all students as they enter the bus. This can be done by a monitor. The hand sanitizer station may be mounted, but we haven't found a good place to mount it. There's different size pumps that are available, and we're continuing to work with manufacturers and dealers regarding locations. However, during the summer months and the fall when it's really hot, it's not recommended to leave hand sanitizer on the bus due to the flammability of it. So once we've done once we've looked at these areas, the next area are the number of students that are allowed on the bus. Now, the number of students on the bus is going to depend on the prevalence of COVID-19 in the community. It will be important for districts to discuss with their health departments to determine if full loads are acceptable. We've provided charts for the districts that are at 2/3 capacity down to 10% capacity. Obviously, the rated capacity, if you're going to do full loads, that's 3 students to a seat, including the front 2 seats. Okay, we are recommending that the front 2 seats be left open, one for students on the right side, one for students who may be sick, and on the left side so that students are not breathing and having their particulates land on the driver. Now, a district may determine if it's safer to load the 66 passenger bus at 2/3 capacity, which would be 44 passengers. It may be actually 40 passengers if they leave the front 2 seats open for the potentially sick students and leaving that area for the driver. Now, with any scenario, we do not recommend leaving students at the bus stop if they have a temperature, unless the parent has been contacted and doing so has been approved. It's much safer to take the student to school versus leaving them alone, and each district will need to create a contact plan and procedures to address these issues. Now, lastly, we have provided employee considerations. Oh, excuse me, ventilation. We want to ensure that ventilation is being done on the bus. Whether the bus has AC or not, the windows should be open to allow the fresh air to flow through. That may mean that the windows are cracked every other window. It can mean that some windows are opened all the way and others are closed. We're also asking that students that are maybe at a higher health risk be sat in the front area, allowing for pollen, allowing for the windows to be closed so that pollens or other things that may be exacerbating asthma symptoms are basically kept away from those students as much as possible. And then we'll go into employee safety considerations. Temperature checks for all employees should be done daily, just like in the school, even if the driver starts from home. They should take their temperature, inform their leadership if they have a temperature above 100.4. They must wear a mask or face shield when on the bus. And for those who are unable to do so, it's going to be up to the districts to determine if the route that they're on is acceptable without a mask. A district where the leadership may be aware that if there's students on the bus with immune deficiencies, and so that driver may or may not be allowed to have that route. We're also asking drivers to wear gloves when assisting students. And in between routes and at the end of the day, the buses need to be cleaned. We've provided cleaning guidelines for the buses. The high touch areas and any used seats should be cleaned. This may require additional staff between the routes, and each school may have someone that goes through and cleanse the bus with the driver. They can start at opposite sides of the bus and work their way to the middle, and this will decrease the amount of time that it takes to clean the bus and the amount of time needed in between their routes if they're doing double runs. Now, in the garage, employees need to enter through one door and exit through another door to the extent possible. Social distancing should be adhered to, and shared tools need to be cleaned between use, just like in the schools. At the end of the day, surfaces should be cleaned as well. Anytime a technician goes into the bus, they should be wearing a mask and cleaning the area they are in when they enter and when they leave. Face masks should be worn in the garage anytime social distancing is not adhered to. Now, driver barriers, we've had a lot of questions about this. Those are not approved for buses at this time. There is a national task force that is looking at some of the options out there, but due to safety concerns, it has not been approved. We do have links out there for districts so they know what chemicals can and cannot be used on the bus, as well as how to properly clean the buses. We do ask that all the drivers have sanitizing sprays and towels available to them, and that they don't store the aerosol cans on the bus because, again, due to high temperatures, those may explode. Lastly, we're going to go through the different items that we've provided as samples. So the first one would be the sample survey. Now, this is a sample survey for parents. The district sends this out to parents to ask, basically, are your students going to ride the bus? If not, why? How many students do you have? What grade are they in? And just general questions about mask wearing as well. The next item is the temperature checks. This is what we use at KDE, and as I think it got stuck. If you scroll down a little bit further, we have a health assessment form that we utilize as state employees. And basically, it's asking if you've had a fever, do you cough, is there shortness of breath, do you have chills, muscle pain, sore throat, loss of taste or smell, and new loss of taste or smell, and other symptoms. And so anytime we go into our building, this is something that we fill out. You can utilize this or something like this, whether it be for drivers, teachers, or anywhere else in the school, other staff, to determine whether that person basically should be in school that day or not. And this also helps with contact tracing. So if they are at school, you know what day they've been at school and what symptoms that they had. And lastly, we have the bus manifest. Now, this is something that you guys may have seen as teachers for field trips. Well, this is something that they're going to have to use on a daily basis. Again, it's for contact tracing, whether they use two students to a seat, one student to a seat, or three students to a seat, depending on the prevalence of COVID-19 in the district. They need to have this every single day for every single student so that it can be turned in to the office or to the district. And if the health department needs access to it, they have access to it. And it's just really simple. It doesn't have to be complicated. And just for your knowledge, I will be meeting with transportation directors tomorrow at 12 o'clock Eastern through the Kentucky Association for Pupil Transportation and the Student Transportation Association of Kentucky to help answer and work through some of the questions that they may have come up with since this has come out. At this time, we'll take questions.
I've got a question.
Sure.
So of course, I've done a lot of bus duty over the last 20 years. One school that when I taught in Lexington, we literally marked off like 350 kids on the way in and the way out by name.
Mm-hmm.
And once you know everybody, it's not so bad. So, and I've done the car line the last few years for that pulling up. But has someone actually, the plans they look great. The plans that we've seen for classrooms, I mean, they're actually phenomenal considering none of this happened like a year ago and we had to just start planning these things. But, or has someone actually like gone to the, physically gone to a bus, sat a driver or somebody in there just to see how long this is going to take so the school's prepared or parents are prepared? Because obviously, we're all used to, kids get picked up, kids get dropped off, they get in, they get breakfast, they go. So obviously it's going to change everybody's day, even though the plans are great. Has anybody actually like done a time clock thing? This is going to be a bigger part of your morning.
So I can tell you that at least one district has at the bus stop with picking up students and giving them hand sanitizers if they were going to check their temperature. That takes an extra 10 seconds or so per student. Okay. At the end of the day, depending on how many students are actually on the bus, or not the end, and at the end of the route to do the checking of the manifest, making sure that they have all the students listed, that's going to take probably 2 to 3 minutes. But as they get better at it, they're going to become faster at it and more efficient at it. But our districts, those are questions that they have, definitely. And it is something that, as I'm working with directors that have staff in, we're able to do that. But as of right now, we don't even have all schools that have all staff in to be able to do some of that. But we are working closely with our districts. And so as that information becomes available, we're definitely sharing it with each other.
I appreciate it. Like I said, car line and bus duty has been a big part of my life over the last 20 years.
Right.
So I admire everything, all the planning that goes into it.
Well, thank you for your question.
This is Kay, and definitely having a chance to do a walkthrough or a simulation of your plan for student arrival, I think is very important. A few years ago, Fayette County implemented metal detectors where students had to walk through the metal detector to get into the building. And at the start of that process, apparently there was a bit of a bottleneck, as you can imagine, but after a couple of days and figuring out what would make that line move faster, they were able to adapt very well. And there may be some learning that we can get from that to help mitigate. I've had communication with one superintendent who had a particular plan, and he wanted to bounce that off of me. Do you think this will work if we do this? And I said, well, you're meeting social distancing, your kids are masked, they're getting in out of the weather, they're not standing outside waiting. So it sounds to me like you've got your bases covered. So again, thoughtful planning and visualization of how is this really going to work, I think are absolutely key to success for this. And the sooner you can start on that in the summer, the less anxiety and the less apprehension, the sooner you can communicate to your families.
And that's also part of what we're doing tomorrow through what we call KPT and STAC, is meeting of the minds. And their plan is to meet every couple of weeks to hash out what are some of the barriers that they have, and to work together on that. So,
as I sit and listen to all this, it's real easy to get overwhelmed, I think, when you just think about everything that has to occur, and almost just participating, I almost feel like an anxiety as a result of it. But I think it's important that we realize that this is not the responsibility of a student. It's not the responsibility of the superintendent. It's not the responsibility of a principal or a teacher. It's all of our responsibility. And I think that if you approach this kind of logically and you just look at all the things that have to occur, you have a lead on the things that have to occur, and then you bring in as many people as you possibly can, right down to students, even if it's possible, that can help with the communication, that can help with busing, that can help with working out temperature or parking or entering the building. If you approach it that way and you have a solid group with the strengths that are needed for each of those things to happen, then it kind of makes the anxiety start going away. And I hope that's how school districts are really trying to take all this and really trying to plan for what school's going to look like. Because as Nora, very emotionally said, I mean, we've got to get all this done, but we cannot lose sight of the social emotional aspect that kids and adults are going through. And so I think the more people that are involved in working through all the puzzle pieces, I think the less anxiety people have. I mean, if you've got kids involved in like creating videos, and you've got parents involved in working with the buses and all that other stuff, a community approach can just make you just feel a whole lot more comfortable. And I think we have to really focus on that it is overwhelming, but if we're all doing our part, whatever that may be, and it will involve rolling up our sleeves and doing more work that maybe hasn't been on our plate before, but I think the anxiety will disappear, and I think we can all make it happen if we just approach it that way. And that's what we got to focus on, but always keeping the social emotional health of our kids and the adults at the forefront of everything that we're doing. We're probably going to lose some instructional time. It's going to take more time to do things. It's going to take more money and more resources, more human resources to do it, but that's okay because our kids are worth it, and their social emotional health and the social emotional health of our adults is worth it as well. So we can do this. We can get through it. Just we got to take it at one little puzzle piece at a time, I guess. That's my 2 cents.
Very good point. And just remember on this call is that this is an advisory call. You can talk even if you just have a comment or a concern. You don't need to just have a question. So anything, and then I'm sure we're going to get into that in the closing segment with public health.
Yeah, I so appreciate those comments. I think our students are going to take the lead of us as far as their attitude goes. If teachers and administrators, if educators, if all hands on deck come in with a positive attitude, our students are going to feed off of that. 6 feet is not that far. It's really not. When you are standing in line at the grocery store 6 feet apart from the person in front of you, you can still say hello to them. You can still speak to them. Our students are still going to be able to talk to each other in a lunch setting. Our students are still going to be able to be in community with each other. It's just going to look different. And so we have to come in with a mindset of, as Governor Beshear says every day, we will get through it and we will get through it together, but we have to have a positive attitude. If we come in a negative attitude of this can't work, then our students are going to have the attitude and our families are going to have the attitude of this can't work. If we come in knowing that we are going to have to adapt each day and problem solve each day, then it's going to be fine.
Great point.
Any other thoughts, comments, feedback around transportation guidance, concerns? Okay, well, we'll transition to item 6. This is guidance on safety expectations and best practices. So I'm going to pull up that slide deck. And I'm going to turn it over to Dr. White and Commissioner Brown.
Dr. White, before you get started, first I want to thank you again. And I don't know if Dr. Messerly is also on here, for your continued work with us. And you've been great throughout this. Just want to let everyone know this has certainly been a process, and these are safety expectations. And They are what the health experts in Kentucky, and then they consult with their colleagues and health experts at CDC and in other states believe that we need to do to protect students. And we had a lot of back and forth with public health on just like you may ask your personal doctor questions about things because they're experts in health and you're not. We had a lot of questions. They informed us of a lot of things, and I think we informed them of a lot of things because we are the experts on the school side. And so it's been a great relationship back and forth. We were able to achieve some flexibility. One of those you heard about with the buses, some flexibility there in how students can get on the bus without having a temperature check first, those types of things, and we really appreciate that flexibility, but still with safety in mind. So I want to thank Department of Public Health for that partnership. That doesn't mean the guidance is perfect. We have yet to obviously be back to school to see it fully realized. We know there will be things we have not thought of. But we've tried to also monitor what's going on in other states. We've been participating with the Southern Regional Education Board. They are producing a toolkit for reopening school that dovetails in nicely with our guidance, is consistent with our guidance. And so I believe we are on the right path in Kentucky. And I think we're also benefiting from the actions taken early by our state that were not necessarily taken in other states. That doesn't mean we still don't have a serious issue here. We do have cases that are rising, and I know there's a debate going on in local school districts and local boards of education. I just read a few tweets from some local board members, debating on whether or not it makes sense to go to in-person classes at least the first few weeks. I know of at least one district, after surveying their parents, they are not going to go to in-person classes at least the first few weeks. They're going to start off with NTI. And that is how we design all this guidance over the summers for local districts to use consultation with their local health department and try to make these decisions that fits their community. And then with contact tracing, we know we can be more nimble, more surgical. And if there are cases in counties, or if there is a flare-up in a county, we can look at more regional recommendations from the state level on closing, as well as even maybe if a student is exposed, you may only need to isolate that fifth grade classroom and even part of the classroom, and this is all because of contact tracing, and not necessarily close the entire school for 14 days or the district. So that's a little bit of a good news, because I think we have more information now than we did last semester. However, it's still there's still a lot of concern out there. We're hearing from other states about, we continue to hear more and more school districts are backing away from starting in person, or at least looking at hybrid models. And we're going to continue to have these discussions and monitor this at the state level. But right now, districts are encouraged to make these plans with their communities. Continue to engage that reopening task force that we encourage every district to create, a reopening committee. We're hoping that school-based decision-making councils are discussing these issues, knowing that none of it's going to be easy. So I wanted to give you a little bit of an overview about how we arrived at this document and at these decisions, all the while knowing that just because we issue these guidance documents doesn't mean that we've washed our hands of it in Frankfurt. We're continuing to monitor these things, knowing that some of this guidance can change at any minute. So Dr. White, if you want to just, I don't know if you want to take questions or have some, if you have any presentation, if you want to just go over the major parts of the reopening guidance. I'm not sure what you'd plan to do.
Well, thank you, Commissioner Brown. I really have enjoyed listening. I've been on a lot of calls, but have not been on with any teachers. So this has been very enlightening for me as we I have been talking and discussing, and I think I started calling in on these meetings probably the middle of May. And you are correct, Commissioner. I have learned a lot about education. I don't have any children personally. I have a granddaughter. So I'm learning about education quite a bit. The other thing is, because of some personal issues, I'm working from home today, and for some reason my home internet has decided not to work with Microsoft Meetings. So I can't see anything that y'all have been showing, but I think I've seen all the PowerPoints before in other presentations. If you've seen the flagship document, it's been talked about quite a bit today. I will have to give KDE, I think they've all passed their public health midterm with flying colors, because the document talks about social distancing, face coverings, protective equipment, screening, in going onto the school campus, sanitation, and contact tracing. And I think everybody in all the different areas have covered that very, very clearly. I really want to go back to the idea of the video. We've talked from the very beginning that the school systems in the United States has been the changer of cultural norms throughout our history as a country. Women weren't educated. Women were property and chattel until we started being able to educate women, and then integrating women into the same school system with males. The same thing with race relations, and how schools and Brown versus the Board of Education is pivotal in the history of this country. So we look to the schools. I don't know that they signed up for this, but we as the rest of the country look to our school system as the leaders, the thinkers, the creative people that know how to make new cultural norms work. We are in a spot, and I don't think I need to probably go over the virus itself, other than to say the fact that it's called a novel virus means that nobody on the planet Earth has been exposed to it, so none of us have any immunity. And that's why we're seeing it in such a devastating way. In the Department for Public Health, we are obviously concerned as we're seeing our numbers go up. I think if you look at any kind of chart, you see the case numbers go down when we went into our healthy at homes, and then we see the case numbers going up as we have now gone healthy at work. And our real concern is we expect the numbers to go up, but how much up are they going to go? And then 2 weeks later is when we begin to see deaths for those whose immune system is unable to fight this virus off. So that's where we are. We know we can't all stay in a bubble forever, and we understand, as the teacher so eloquently talked about, those social emotional needs of those children. But we also feel there's some social emotional needs to make sure that the people in the community are healthy, which allows us to have a healthy economy, which is also, then that gets back to healthy for the children, because if they don't have food, if they don't have a place to stay, that's also a social emotional stress. So it is a huge jigsaw puzzle with lots and lots of pieces. I spoke yesterday on a call similar to this with the Council on Post-Secondary Education, and they were asking me different questions about things that could happen at school, and I said, you just need to understand nothing is going to be like it was last year. That's nobody's fault. It's just not. So when you're looking at homecoming and you're trying to have homecoming but change 2 or 3 things, that's not going to happen. Homecoming's on its head now. Your careful instruction, your empathy and affection for your students is going to have to look different now. And the good thing is, I don't see this as being permanent forever. But when you're 6 years old, a whole year is forever. Shoot, when you're 15 years old, a whole year is forever when you're waiting to get to be 16 to get your driver's license. So this is a period of time that you are correct. This is very pivotal for our kids. Fortunately, kids are a lot more resilient than adults. And we set those expectations and those goals. And when they see us as grown-ups doing that, they'll mirror that. Unfortunately, when they see adults that aren't acting like adults, they mirror that as well. So your profession is the critical piece in all of our lives, in your lives, in my life. And I appreciate that concern and caring that you have. And all we can do in public health is to try to lay out what we know, and what we know is very, very minimal. Most of what we know about this virus is what we know about the other coronaviruses that have existed in our world, and we're just kind of working off of that. And when people ask me questions as a physician, I usually say, you know, as a physician, you don't like to say I don't know to a patient, but I've gotten very comfortable in an odd way of telling people we don't know a lot of the answers. So anyway, I don't mean to wax on and on. Let me stop talking. We've got 12 minutes, and I will do my best to answer questions that could be helpful for you.
Questions, comments, concerns, and I will state this, you know, Dr. White, I've heard you say this about because we do not have a vaccine for the coronavirus, because we do not have treatment, then the three things we know that can mitigate the spread: wearing a mask, spreading out, social distancing, and washing hands. Generally, washing hands that's accepted by our society, or we're used to doing that. We at least hope so. We know teachers sometimes still wonder whether students have done that when they go to the bathroom, but we know that's socially acceptable. Spreading out is fairly easy to do. You know, we're accustomed to being on top of each other when we're in stadiums and that kind of thing, but maybe easier. But then wearing a mask has been something, unfortunately, that's gotten us caught up in politics and other things, and that's unfortunate. And so teachers, we understand that, you know, when we talk about you have the support of your communities and the society, when a child comes in and takes their shoes off or takes their shirt off, it's not necessarily easy to deal with that situation, but you're supported by society, and getting that shirt back on and getting those shoes back on and managing that classroom situation. We've got to get to a place quickly in the next few weeks where society fully supports you, and that child knows that that is their expectation, to have that mask on, just like their shoes or their shirt. And I think we're gradually getting there, as we talked about a few minutes ago, but make sure you understand, we know the challenge that's going to be for you, but we also know that these are the only three things right now that can assist us. So please share with us your comments, concerns, frustrations while you have us here.
And one thing that's been mentioned is contact tracing. And I think most of you as teachers have seen that happen when there's been an outbreak of chickenpox or mumps. But contact tracing has been around for decades. And the local health department will come into your school and help you determine who's high risk, who's not, and who needs to be quarantined. So that's not a responsibility of you as a teacher to have to do that, or the school system itself. I just wanted to throw that in there because I think that confuses people sometimes.
I do have a few questions. Again, it's Angie from Franklin County. I was thinking, I mean, I'm hoping no teachers get this, but I mean, it's far likely to happen. And therefore, what would happen? Like, obviously the teacher would need to quarantine. With the whole class of those 10 or 12 kids that were there also quarantine? Would we be expected to teach from home, or would we get those 14? Because I mean, you never know how sick you're really going to be. What, do y'all have a protocol for that, or is that by the district?
Well, I can speak to the isolation of the teacher. If you are positive for COVID-19, yes, you would be expected to stay home until the health department rules your isolation over. And then exposure to other faculty or staff or your students. It all depends on how close you were to them, for what period of time, and were masks worn. And that's something that the contact tracer will work through and then make that recommendation. And then I'll let Commissioner Brown talk to the employment aspect of that.
Right, and that's exactly why contact tracing is so important, is that it means that we could then isolate only that classroom, or even a portion of that classroom, or if it's a student, maybe only the students that were in close proximity to that student would have to be quarantined. And that's why, and we're asking districts obviously to cooperate with contact tracing to provide those bus manifests, to talk to the tracer about, well, no, Kevin sat here at the cafeteria and he was table and he was 6 feet away from Connie. And that's why that's important. You all won't be doing the contact tracing, but will be assisting in the information needed to do the contact tracing. The employment issue, obviously, it's going to depend on whether or not your physician and in consultation with your health department, the level of your symptoms as to whether if you were asymptomatic, then you very well may want to be able to work from home, and then that could be worked out with your district, assuming your healthcare provider, cleared you for that. Those are all going to be individual determinations at the local level. But the hypothetical you presented, I think that's certainly possible, assuming there are positions there that can be done virtually, which we obviously in this environment we think there will be, and then whether or not it would be advisable for you in your medical condition to perform that work remotely, even though you may be in quarantine.
Okay, I understand that. And, there are different levels of how sick people are getting, and some people don't get sick at all, is what I'm hearing. But if I were too sick to teach from home, or anybody, and would I have to take those 14 days of my own sick days?
That's probably the hot topic of the week. We're working through our legal team and also consulting with Kentucky School Board Association and some others. We're going to be providing some guidance to districts about what those scenarios look like, because we have several things going on. We have an emergency leave provision that right now emergency leave is limited by statute to 3 days, as you all know. That was lifted in Senate Bill 177. For school districts for just last semester, because I think, and to the credit of the General Assembly, we didn't really expect, we thought we'd get through this by the summer at least, and we wouldn't be dealing with this year, and so it only applied last year. I'm going to be signing a memo this week that waives that pursuant to the governor's emergency authority, so we can allow districts to then grant additional emergency days as needed, just like they did and were able to do last semester. So that's one element. You've got some emergency family medical leave provisions that the Congress has passed that are still in effect due to the emergency and the pandemic situation. And then you've got your traditional leave, and then you've got issues with quarantine. And so we're working through all of that to help guide districts, as well as provide, and I know the school board councils are also working through that. So I don't have a clear answer for you other than it is an issue. There are various avenues that leave can be granted. And then it gets tricky, of course, any type of personnel legal situation. So we hope to provide some better guidance to superintendents over the next few days. And some of it's just putting guidance related to emergency leave in the same document as guidance that's already been issued for the emergency FMLA leave, layered in with what policies may already, exist at your local level.
Okay, I just have one more quick question. I know washing your hands is best, and I do have a sink in my classroom, but of course they're touching the sink and this, that, and the other. And usually we ask on our supply list for parents to provide, Clorox wipes and hand sanitizer just on a normal year, but that's going to run low again, I feel like, and it's getting more expensive. I don't know if they can afford it. So will the state be like allotting certain sanitization products to schools that can be kept in classrooms?
Your CARES funding that's been allotted through, it's come through the department, but through the federal government as appropriated and passed by Congress and signed by the president, the CARES funding, the majority of that can be used to purchase that kind of equipment. We're also working to make sure, and I know co-ops, education co-ops that have purchasing agreements have been working on making sure they have procurement contracts in place for various needs, an increased amount of that type of material, as well as the state finance cabinet districts can purchase off that. So we're trying to do a better job of communicating to districts the various avenues they can purchase that in bulk. We are not providing it at the state level other than providing guidance on how they can access it through procurement. If there is a need and if there is a shortage, obviously working with public health and the finance cabinet to try to get that to districts and use various avenues to get it into the state if there's a shortage. A good example, Department of Public Health, they were able to acquire on behalf of school districts over 12,500 instant digital thermometers. Those are being distributed, I think, as we speak, through the area development districts to your school districts. So I think if you do the rough math, that's around 1 thermometer per 50 students. So, and it may be even a little bit less than that. So that's good news.
Okay, great.
Kevin, this is Kay. FEMA is also available. I think all Kentucky school districts have made an application to FEMA, and some of the expense related to disinfection and some of that other stuff can be reimbursed through FEMA. That's available as well.
And just for interest, our local distilleries throughout the state have been making hand sanitizer, so they've got it at a reasonable price for people to purchase.
This is Quentin Johnson. I'm from Tates Creek. I have a question going back to facilities. So in my classroom, I don't have a window. And recently we've had issues with air circulation, air quality issues at school. So what can I do? We do have dehumidifiers in the room. I don't know. I remember that being mentioned earlier. Is that something that could help with circulating the air, or at least putting the air through some sort of filtration to help with particles?
Yes, the ASHRAE group, the American Society group, has recommended humidity control as a mitigating factor. So definitely would explore with your building administration some options around the ability to utilize another space that may allow for more ventilation, whether that might be, just on a couple of days a week you might go here, or whatever the alternative is. That is not a good situation at all. Are you all undergoing a renovation?
No, they're building a new school as we speak.
Yeah, I thought there was some kind of construction going on there. So, in a situation like that, there's no good answer other than I would encourage people to keep their masks on as much as they can to just help stop spread. So I don't think you have a good answer.
Okay. Thank you.
So if I make a comment quickly, can you hear me?
Yes.
I, of course, taught art the last 20 years. I've taught in old buildings. I've taught in brand new ones. I was actually an industrial technician before, but some of the places may consider, I've been in many buildings over the years, you open a couple doors and on each end of the building, it's almost like the building is pressurized. And some of the facilities, they may open up a door on each end, and it will blast a lot of clean, fresh air through the building, within a couple minutes, one end on one end on the other. And you can get a lot of fresh air. And if you're in some of these older buildings, you might have been near a door where somebody opened up that door and then all the fresh air came in. So that might be one thing that people keep in mind.
And even if you can only do that on a periodic basis because of other security concerns, that is definitely something that should be discussed and maybe even planned for, that at 10:30 in the morning, we're going to have the indoors open for 15 minutes to do circulation, and somebody will be standing there to watch the door. But I think the flexibility definitely has to be part of the conversation.
So if we do have ceiling fans in our classroom, should we be running them like throughout the whole day? That's probably a stupid question, but I do have fans in my room.
Hello. Hey.
Anything you can do to increase the ventilation is probably helpful.
This is Taylor Sullivan from Boone County. I wanted to raise a concern that is, out of our control in the K through 12 setting, but I have 2 young children that need to attend daycare if I'm to return in full person classes. Our current issue is under the recommended class sizes for each age group at our daycare. We currently don't have the ability for my children to go back to their normal school. And I know that this will be an issue for many of our teachers who have had the ability to keep our kids home this summer, and in some capacity during NTI when daycares were closed. I know there are also currently some lawsuits going on to expand class sizes at our daycares, but that again does not make me feel comfortable that our kids will be protected. I know that they are at a lower risk than some of our others, but we have family members who are in the high risk category. So them coming home could potentially increase the spread. And I know that that is a big concern for many of the teachers in my district.
And this is Dr. White. Right now, that's being appealed by the governor's office, and I have no tea leaves to read to tell you what direction that's going to go. My understanding is right now that 10 classroom limit has been rescinded, and it is an appeal. Is that your understanding, Commissioner? You're the lawyer, not me. I'm the gynecologist.
I think he had to step away to take a call.
Okay.
Yeah, he's on a call and he has another Teams meeting that he's supposed to be in on.
Well, that's my understanding of where we are now. So you just are going to, and you're right, it's 10 kids is so small, it decreases the number of daycare available. But 28 kids in a daycare center, which allows you to have more kids in daycare, which gives better flexibility for parents. However, how safe is that? And as I told you at the beginning, nothing is going to be the same for the next year. And quite often we don't have really any good answers. We just have to take the best answer we can take and run with that. I quote Maya Angelou quite often, who she says, do the best you can do. And when you learn something's better, then do better. And that's pretty much what we've done since March, when we had our first case. Was we knew what we knew, and then as we learned better, at first we were told masks were not needed. I think that mainly was being told to us because they didn't want us to take masks away from healthcare professionals who were dying in the process of caring for people in hospitals and EDs. Then the research came out and said, yeah, it does keep you from spreading to other people if you wear a cloth mask. So we did better. And now there's just been some new research this last week that says it also will protect you, the mask wearer, from others. So we continue to layer what we know. And that doesn't answer your question, and that doesn't fix your problem. But unfortunately, that's all I can add to the conversation.
I do appreciate your comments on it, and I know it's outside of our control here. I do also have a concern that if we're unable to increase capacities, which I still am not sure about the safety, our daycare has said that they will reevaluate the cost of attendance in August in order to offset their class size reduction. So it could also become unattainable for many of us to afford our kids to attend. And it's a sticky situation, and I want to do what's best for my family, but also for the students and their families.
And usually the fallback, or often the fallback in most situations, is you get grandma and grandpa to do that. Well, they're probably not the best babysitters at this point in time. Yeah, I'm 66 years old and have an autoimmune disease, and I don't need to be taking care of a young child who's interacting with other people. So every corner that you turn to that you would have normally gone to has a conflicting a conflict for you to make a decision.
Okay, well, I'm going to interject as it's 12:07 and our meeting was supposed to adjourn at 12. Just encourage everyone, if you have additional comments or questions or feedback that you'd like to to share either with the individual presenters. I'm sure they'd be happy for you to reach out to them, or you can contact me and then I'll share the information with them. Choice is yours on that, but certainly anything that you want to follow up with, feel free to share that with us. I'm going to go here to our last item on the agenda, item 7, reminding everyone of our upcoming meeting dates. You'll see that we will be reconnecting October 1st, 2020, and not sure at this point in time whether it will be a face-to-face or a virtual meeting, but I'll certainly keep you updated on that. But go ahead, if you don't mind, and make sure that you've got these dates identified within your calendar. That takes us all the way up until June 10th, 2021. Another thing that
get the exit slip as well during your closing. Okay.
Well, that's what I was getting ready to say. Thank you. Another thing is that we have included for this meeting that we had not in the past is an exit slip that solicits more information from you as participants, and the information is around your level of engagement. It's also soliciting your input about topics for future meetings and such. And on the slide deck here, you'll see the live link for that exit slip. And if you could possibly complete that in the next day or two, there's going to be some review of that information that's going to help guide planning for our October 1st meeting. So with that, and of course, if you have any issues accessing that exit slip, please just email me directly, and I'll make sure that you get the access. But it is a live link there whenever you click on it.
The link is also in their chat box.
Okay. Yeah. Great. Thank you. All right. So with that, we do need a motion to adjourn from one of our TAC members.
I'll make a motion to adjourn and thank everybody for their time.
Yeah. Thank you, Nora. And a second?
I will second.
All right. Okay, so with that, we will call our meeting to an end here and look forward to connecting in October. Thank you very much for your time, attention, your insight, your very, very thoughtful feedback.
And thank you for having Department for Public Health here. We're welcome to answer questions that you might send in as well. Thanks.
Thank you.